Hello friends, on the occasion of World Health Day, I am going to read today's The Hindu article Prescribe Preventive Medicine for a Healthy India. India stands by Dr. Pratap C. Reddy. India stands at the cusp of economic glory, aspiring to become a $5 trillion economy and a global powerhouse. However, there is a silent epidemic of non-communicable diseases that threatens our economic and developmental ambitions. Today, NCDs are the leading cause of death in the country, accounting for roughly two-thirds of all deaths. To secure a healthy and prosperous future, India must urgently embrace a preventive healthcare mindset, one that can heal before there is a need to heal. The rising tide of NCDs, their economic toll. Over the past few decades, India has undergone an epidemiological transition. Communicable diseases such as infections have come under control but have been overtaken by NCDs. Chronic conditions such as heart disease, diabetes, cancers, chronic lung diseases, and stroke kill an estimated 5 million to 6 million Indians each year. What is particularly alarming is that non communicable diseases are striking Indians at younger ages. India's working age population is increasingly affected, a disturbing trend when its GDP target relies on the youthful demographic dividend. In fact, 22% of Indians over 30 years are at risk of dying from an NCD before they hit the age of 70. We see this mirror in our hospitals every month with 30 to 40 years old with heart ailments or in need of dialysis due to diabetic complications. Beyond the human cost, the economic impact of non communicable diseases is staggering due to the resulting loss of productivity and reduced workforce participation. Studies estimate that NCDs may already be costing India around 5% to 10% of its GDP. A World Economic Forum and Harvard School of Public Health study projected that between 2012 and 2030, NCDs would inflict a loss of around 3.5 trillion to 4 trillion on the Indian economy. Hence, an investment in preventive health care is not an expense but an economic strategy. Prevention is our best insurance policy for sustainable development. The good news is that most NCDs are largely preventable. Sedentary lifestyles, unhealthy diets, tobacco and alcohol use, pollution, and genetic predisposition are some of the key culprits. By modifying this, we can significantly reduce NCD risk. It is estimated that about 80% of premature heart disease, stroke, and diabetes cases can be prevented by addressing lifestyle factors. Today, around 22% to 23% of adults are overweight, and there is an urgent need to tackle obesity. We must make physical activity a part of one's daily routine with at least 30 minutes of moderate exercise a day, be it in the form of walking, yoga, or sports. A healthy diet rich in fruits, vegetables, and proteins, and lower in sugar, salt, and unhealthy fats is a must. Air pollution is a health emergency directly impacting rates of chronic obstructive pulmonary disease, lung cancer, and even heart attacks. We must view pollution control as a part of preventive medicine. Finally, the most important measure is regular health screenings, detecting these conditions early through screenings starting at the age of 40 years or earlier if there is family history can literally be a lifesaver. Early detection means timely intervention, controlling blood pressure before it causes a stroke, or removing a precancerous polyp before it turns into colon cancer. Screening such as mammograms for breast cancer or HPV tests for cervical cancer can find early curable stages of disease. Technology can transform prevention. Digital health technology, from smartphone apps and wearable to big data analytics, is a game changer. India has over 750 million smartphone users, which means we have the ability to deliver health advice, reminders, and risk assessments in the palm of everyone's hand. Wearable devices and health trackers allow individuals to keep an eye on their health stats. The integration of such real time data into preventive care plans is an exciting new frontier. Most transformative is the role of artificial intelligence in predictive health modeling. AI algorithms can analyze vast data sets to predict an individual's risk for various NCDs with remarkable accuracy. AI tools can analyze an individual's profile and generate a health risk score that forecasts the likelihood of, say, a cardiac event or developing diabetes over the next decade. AI also helps in early diagnostics. For instance, machine learning models can scan chest x rays or computed tomography scans to detect early lung nodules or early signs of fatty liver that a human might miss, enabling preemptive action. However, preventive medicine augmented by AI should always remain human, compassionate, and patient centric. Used responsibly, digital health and AI will be our greatest allies in making preventive care more proactive, precise, and accessible, fostering a preventive mindset. Preventive medicine is not just a set of services but a mindset. I envision a future where every individual, community, cooperate, and government thinks health first in every action and policy. Individuals must become the champions of their own health. I urge every reader to schedule that checkup you have been postponing and make small daily changes such as taking the stairs or cutting down on sugar to protect your well-being. Corporates and workplaces play a pivotal role by investing in employee wellness programs, from annual health checks to in-house counselors and fitness sessions. Healthcare providers must pivot from a reactive care model to a preventive care model. The government's role is extremely important, and initiatives such as National Program for Prevention and Control of NCDs and the establishment of health and wellness centers that focus on screening and prevention are stellar steps. Beyond this, public policy should also be health oriented. Urban planning should create green spaces for exercise, education, curricula should include health and nutrition, and food industry regulations should encourage reduced salt and sugar. In the years that I have striven to make preventive care accessible and impactful, I have seen thousands of lives transformed because a disease was caught early or a risk factor was managed in time. Every individual has the power to make choices that guard their health, and those choices, scaled across 1.4 billion Indians, can help define our nation's health and happiness and ensure we reach our economic goals too. Thank you for listening.